Good morning, friends. Welcome to our next teaching session. And today's case is a patient with left ventricular failure. This was the incidence of 1990s when I was looking after patients in a nursing home run by a friend of mine. My friend was doing general practice, and the patients related to medicine specialty were seen by me. My friend's family had gone out of Delhi, so he asked me to look after the nursing home in his absence. I was seeing those patients who were minimum and giving minimum essential services to the patients, as I was not doing general practice, where I noticed a girl sitting there in the morning. The girl was sitting there even in the evening. I asked her what is the problem, and the patient was shown to me. She was a poor girl who was pregnant. She was severely anemic. So I told them that she needs blood transfusion, and since he cannot be arranged in the nursing home, you take her to the hospital. They went to the hospital and came back again and told that the hospital has asked us to make arrangement for the blood, which we have not been able to do. So I explained to them that here also, in a small nursing home, we do not have a blood bank, so you have to arrange blood. By some difficulty, the parents were able to arrange the blood. We got 1 unit of packed cells and started the intravenous infusion. Gave strict instructions to the girl's mother and father and to the nursing home staff that patient should remain in propped up position. In no case she should be lying supine. As I said before also, the patient was not only severely anemic, she was also pregnant, and this is the reason we had to be extra cautious. By evening, the patient became breathless. Difficulty in breathing was so much that people had to call me, and I, suspecting fluid overload, gave 60 milligram of Lasix intravenously. But patient's difficulty was more. I, suspecting that this could be a big problem, I arranged to shift the patient to a hospital. I arranged the ambulance and I transported the patient in my personal supervision. Friends, this was such a poor patient that these type of patients do not come to me. I, just out of pity on the patient, got involved in giving her blood transfusion. Otherwise, normally I should have refused the patient. But seeing that what she will do, considering these human possibilities, I became prepared to give her transfusion. When the things went beyond control, I had to send her to the hospital. This exertion of the patient due to dyspnea had put the patient in premature labor, and this uterine contractions and anxiety and fluid overload all put together, the patient went into left ventricular failure. The hospital tried their best, but by next day the patient was dead. I felt very sad, where I had nothing to do with the patient, and still the patient died. I tried to help the patient and it went the other way around. What had happened? The patient's mother and father left the nursing home for some work. The poor people, no, not much source of income, they had to run from here to there. And the patient, being tired, felt sleepy, and in sleep she slipped to spine position. Now, nobody cared about this thing, and this is what happens in a majority of cases. That is why I am highlighting this thing, that how much care these patients need. Then, what had anemia done to the patient? We know that long-standing anemia can damage the myocardium. This damage may not be obvious clinically to us, but there are changes. There are changes of anoxia. There are changes in the rhythm. They develop arrhythmia. ये हार्ट बीट की एबनॉर्मलिटीज हो सकती है इन केसेस में कम ऑक्सीजन मिलने से हार्ट मसल को डैमेज हो सकती है. ये चीज़ें जो हैं पेशेंट के जो कैपेसिटी होती है उसको कंपनसेट करने की वो कम हो जाती है. वी कॉल इट मायोकार्डियल रिजर्व. द पेशेंट्स मायोकार्डियल रिजर्व हैड बिकम लेस, सो इवन स्लाइट इंक्रीज इन द वर्क ऑफ द हार्ट कैन cause problem to the patient. So poor myocardial reserve, tachycardia because of anemia, even arrhythmias, increased fluid volume, all these put together can increase the workload, and with the increased uterine contractions of premature labor, the patient went into frank heart failure. So this was a situation where we could not do much. In fact, friends, these are the situations where you remember God, because you can't leave the patient as such, and if you give these things, these problems occur. But what should we do if the care is proper, if we have proper staff? First thing is that give an injection of Lasix before starting the transfusion. This will cause some fluid loss in the form of urine, that may be even 200 to 300 ml, and the packed cell we are giving is also in this range of about 300 ml, so we are not adding any extra fluid to the body. The second thing which is very important we should do is give slow drip. The packed cell infusion should be given at the rate 6 to 7 drops per minute, and this will slowly raise the blood volume rather than suddenly raising the blood volume. And we should be also prepared for all other eventualities, like oxygen should be available, and the life saving injections should be available. So friends, this is how I felt bad about this case, but this was none of my fault. I know it very well, and in attempt to help the patient, we lost the patient. And friends, thank you very much, but my request is again that I send you the link through Messenger and WhatsApp. Please do not give your likes, thumbs ups or comments on the Messenger. These should be given only on the video. Click the link, open the video, watch the video, and then like it or comment on it. Even you are saying that good or bad or nice or good morning or anything will be helpful, because I know that such and such of my friends have seen the video, and that will further help us to improve it. If any of you have not subscribed the channel, please do subscribe the channel. That also will help us further. And thank you very much. We will meet next time with another case.